Okay. I think
Yeah,
we
yeah, yes,
welcome
sir.
you all. Yeah, we welcome all the audience. Like one of the highlight session of our FDP. It's going to be now, and I welcome heartfully Professor Edmund and then Mrs. Nisha and Vinden for the session. Okay, and yes, over to you, Unikrishnan. Please you proceed.
Yeah,
Thank you very much.
Uh,
So our
yes, sir.
Sir, Unikrishnan will be giving introduction.
okay, okay.
Yeah,
Yeah,
sure, sure. One
yeah,
second.
sir. Yeah, good afternoon, one and all. Here, my duty is to introduce the resource persons. So I'm very glad to introduce them for this session who have joined us from Cardiff Metropolitan University, UK. So we have here Professor Edmund C. Prakash. He's a professor and associate dean for research at Cardiff School of Technologies, Cardiff Metropolitan University, United Kingdom. His research interests are in visual computing, volume visualization, cloud computing, and high performance computing. So Edmund supervises PhD, professional doctorate research scholars and master scholars in all areas of engineering, technologies, and computing, including visual computing, digital business, emerging computer technologies, and blockchain. He has published his novel research in the areas of visual computing in all top-tier avenues, including Springer, Elsevier, and IEEE. He collaborates globally with researchers and it includes top universities and institutions in United States, China, Colombia, Singapore, India, and Australia. We have here another resource person in his team. She's Nisha Ravindran. Nisha is an experienced IT professional and company director to Airtel Systems Limited. She studied electronic engineering at Cardiff University and worked in semiconductor technology for many years. She has since worked in investment banking, public and private sector industries, coupled with education facilities in the UK and overseas. Nisha also holds an accounting degree and a Master of Science in Finance and Information Technology. She is currently pursuing a doctorate in cybersecurity, focusing on machine learning application within the SME market in collaboration with Cardiff Metropolitan University, UK, and the business. She currently shares her knowledge as a tutor both at Cardiff Metropolitan University and Glyndŵr University. And we have another resource person, Vinden Ville. He's a research student studying big data analytics, AI, and visualization at Cardiff School of Technologies, Cardiff Metropolitan University, UK. Vinden's background consists of environmental health and data science with current research focused on data cleaning, data analytics, modeling, and visualization. So we at IIIT Kottayam are extremely lucky to get Professor Edmund and his team for our faculty development program. Thanks for taking some time out to speak to us, sir. Over to you.
Yeah, thank you, Mr. Unikrishnan, for the nice introduction. And thanks, Mr. Sabin Jose, for organizing this each session very nicely. And I also thank Mr. Victor Paul, who is the FDP coordinator for starting this program, like from conceptualizing it. And then now we see how this nicely is progressing. And also big thanks to all the audience, like the different scholars and faculty members from across the country, I believe, for joining this faculty development program. I'm sure you benefit from this in a nice way. So well done to the organizers. So our focus today is going to be on security and privacy management, which in some cases we have already heard from all the speakers. They touch upon this a little bit. So we will look at it a little bit in more detail. So our focus today will be more on what's happening within the UK. So IoT in the UK. So we give you a glimpse of things that are happening on this side of the world. So the session is going to be a little bit relaxed, not like the sessions that you have been looking at. So sit back, relax, and all I want you to do is to think a little bit in a relaxed way, and also use the chat function to give some answers for the questions that you see on the screen. I think that should be a very easy thing to do, isn't it? Thinking and giving some answers. So we hope to hear from you as we progress in this presentation. So sensor data analytics. So which layer do you think your work is related to? Are you looking at sensing layer, network layer, middleware layer like the APIs, the cloud running the algorithms there, or in the application layer? Please feel free to type your answers using the chat function. So the question is, do you relate yourself to the sensing layer, the network layer where your work lies, middleware layer, or the application layer? Some people may feel they fit in more than one layer. So do we have any answers from the audience?
Yes, sir. There are answers. Are you able to see the chat box?
No, I can't see. So you have to.
Yeah, so Dr. Ramachandran says that he's in network and transport layer, and Manikam Shankaran says that in the physical layer. Then again, network layer, transport layer, MAC layer, network layer, mostly network layer and transport layer. Yeah.
Okay. So in the sessions, in the previous sessions in the last 3 days, we have also heard from different application layers, like all the smart things that happen. Like yesterday, we had a nice session on smart agriculture, for example. So people do work in many different areas. So if you look at a solution, we need to look at all of them together so that you can get some practical solutions that will be useful for the human beings. So what we are looking at is how important are these to humans? So when people design systems, they talk about, yes, we design these sensor systems, IoT systems that are useful to humans. So we want to go one level deeper into that. So how does it affect humans? Are we doing the right thing for the people? So that's the question that we'll be trying to find some answers. So let me look at some questions that were asked. So this is research by one of my colleagues, Professor Karsten Maple and his team. So the question here is, how many people are aware of Internet of Things? So they went around, wanted to find out from people in the UK. So if you say Internet of Things, how many people are aware of that? So they looked at different gender, male, female. They looked at people from different age group and also like different education level. So if you see the top column there, the top row there, so it says like 53% of the people were not aware of Internet of Things as a whole. And 47% of the participants said yes. This was around 1,000 participants they interviewed. So they went and asked another question. So instead of IoT, if you ask them like, are you aware of a smart home? The answer changed. So if you can see this one, the overall answer was 90% of the people said they are aware of what's a smart home, what are the things that happen in a smart home as compared to an IoT device. So the message here is, as people, like when we design systems, we want to take things closer to the people, understand what the people, how, and relate, communicate
Sir,
to the people.
sir, sorry for the interruption. I think whether you have slide is like IoT in the UK,
No.
but we could see the now it is like a bar chart.
Yes, yeah.
Yeah, fine, sir. Yeah, please go ahead, sir. Because yeah, it's for the very first slide, so I just want to confirm. Yeah, thanks.
Sorry to interrupt you, sir. Sir, could you please make it in presentation mode?
Okay. Yes.
Sir,
So
participants were requesting like a first 2 slides. They want to see like initially it is not visible actually. It was the very first slide. Yeah.
okay, so let me go to this. Let me share my entire screen and then say whether that helps. So first stop share. So you see one IoT in the UK.
Yes, sir.
Yes,
Now
sir.
this is.
Yeah, now
Sensor
it's
data analytics, the different layers which you saw. There is a
Yes,
graph
sir.
here.
Fine. Fine, sir.
And
Fine.
we
Yes.
are in this one. So when you communicate with people saying, are you aware of a smart home? You get a 90% people say, yes, they are aware of systems or devices that are used at home. So a further question asked, like, can you talk about the specific smart home devices? So you can see people use a range of devices, like from a Wi-Fi enabled TV to smart electric gas meters, to using personal home assistants like Alexa and all, and several devices people use, and smart locks and so on. So that takes us to IoT security and privacy. So my question now is, can IoT systems breach privacy? Can personal information be leaked or breached? So what would be your answer? We are using these IoT devices or smart devices. Do you think the privacy is going to be breached in any way from what you have learned in the last 3 days? Can personal information be leaked?
Yes.
Okay, so how do we address that? So when we talk about personal data, in the UK, especially in Europe, we have this GDPR, General Data Protection Regulation, that defines personal data as the name of, they put person in the center, and you have the person name, some of the physical attributes, where exactly they are located, if there is a other or some identification number, yes, and several other parameters that go along with that that can identify a person in a unique way. And this is important. So especially if you are a company running business in UK, if you interact with people, that means the information that you gather should be kept in a secure way. And that's where the GDPR come in. So the Europe actually goes one step further, and then says, if you breach any of this, if you don't follow the regulations, that means you are fined exorbitantly, and some companies can go out of business. So there is an enforcement of the regulation as well. So if there is a company that is talking to another company inside Europe, that means they follow the GDPR compliance. A company in Europe that wants to talk to a company in India, that means they insist that the Indian company also comply with the GDPR. Only then the European company can work with the Indian company. The reverse, there is a company in India, they want to talk to me, and only if that company complies to the GDPR, that means they can have me as a customer. So what happens is, what developed as a European law now suddenly ties the whole world together. And you will see similar thing happening in the World Forum, different economic forum, as well as the World Trade Organization and so on. So you will see this happening increasingly, so that the people are put in the center of any technology that we develop. So let me ask you one more question. So this is what appeared in the Economic Times. So the question is, who is the famous actor associated with this information? Can you type your answer, please? So do you have some answer?
Yes, Aryan Khan.
Mm-hmm. I asked about the famous actor associated with this information.
Shah Rukh Khan.
Okay. But the news didn't have that name, isn't it?
Yeah.
So how did we associate with a famous Mr. Khan to this news? So this is exactly what the personal information is trying to do here. So you have an IoT device or any smart device that captures one information, the location. Maybe another device captures the physical attributes, and then somehow we use all this machine learning, AI, and so on, and that will try to find who that person is. And as we can see from this audience, you are very smart. You see this headline, and then you can quickly associate this with Mr. Khan. Okay, so these type of things we need to make sure it is done properly. So we can't just like that associate somebody who's not in this to this particular news item. Okay, so this is what we need to look at. So when you talk about a privacy threat, now we have associated a name to some other information based on what we see, information we gather from other sources. So a privacy threat is the possibility of the exposure of sensitive data to a person. It could be for a company, and even the technology that we are using, which are not authorized to possess those data. So we need to make sure any information that is we are supposed to use only for that particular purpose in which we are for which we are capturing. So with the development of these new technologies, especially machine learning, you can easily associate input from different devices, and then you can infer a new meaning, like you have identified for the famous actor. So let's look at the different type of privacy classification. So when people look at privacy information, they look at smart vehicles and also what happens in smart cities or smart homes. So there are so many different areas people can look at: privacy challenges in IoT, the attacks that can happen, and the type of data that is collected, whether we are collecting the right amount of data or collecting excess data, and so on. So how do we manage the security? So people use different models. So you can think at the bottom, you can see three different methods. One is the CIA, which people call, this is the confidentiality, integrity, and availability, which is quite commonly used. There are other models also that are used when we talk about security in devices and network devices. So let me quickly run through an example of video surveillance. This is very important, especially from the context of regulation and compliance. So we talk about personal space. If you put a camera inside your house or to monitor an elderly person in the bedroom, so they are fine. You can record them, you can delete them. But if you are putting a camera facing the street, which we see now very often in public buildings, even in houses, people try to capture this. So any data that is captured in the protected space need to comply with GDPR regulations. That means if you're going to share this information, it should be encrypted, it should be anonymized, you need to pseudonymize, and so on. So let me give you some examples. I'm sure some of you can guess this famous actor as well. So if you're sharing face information or people information, we want to do some changes. So obscure the faces so that it's not readily, you cannot decipher it easily. So people call this pseudonymization. But with new machine learning techniques that we have heard in the last 3 days, you will still be able to recognize the type of person or the individual from the rightmost image that you see there. So we need to be still cautious. So other type of pseudonymization is when you share information, you are going to like use many different types, like here to blur the image, pixelate, and so on, so that the person is identifiable only for those people who are allowed to identify the people. There is also encryption that's we are looking at. It's not just the individuals in the frame. Sometimes the background can give information about the person, which we need to avoid. So there are many different types of encryption that go along with this for the privacy of the individual in terms of encrypting the background, and also the type of motion. We heard about motion in the previous session. So we need to hide the information. So all this can go through different types of encryption so that it is properly stored, it's properly shared. So here
Sir,
is an example.
sorry
Yes.
for interruption. There is a request from the audience, like to hide the message. That bottom Zoom message is there, right, sir? Yeah, to hide. Yeah. Thank you, sir.
Okay. So sorry about that. So let's look at a scenario where we want to share some video information. So you have a CCTV camera in your university building, a security camera, and this captures some information. And you want to share this with different people. Like, for example, the university has a security officer called the data controller who has access to this video recording. Let's say there is a theft that has happened. Some computers have gone missing from a lab. So we want to look at it. So that means the data that is captured here is put in using some structures, like, for example, a distributed ledger. People call it a blockchain. So you store it in a secure way. So only people who are authorized to access this will be able to access it. And any changes that happens will be reflected. So you won't be able to go and edit and do some mischief there. So the data controller has access. And then you want to give it to the police for investigating the case, for example. So there is a block that is added to the chain. And finally, it's presented in a court for the court, the advocates and judges to look at it. So once again, we have a block that is added. So by doing this, it's only accessed, it's verified, whether it's the original data itself by different people who are authorized to access this particular data. So you will see increasingly this happening with the IoT devices, where we are using other techniques that go along with that to ensure the data is it complies and it's not altered in between. So how do I go to the shop and buy an IoT device? I want to go to the supermarket and want to buy some IoT device. So how do I buy that? If I want to buy a fridge or a TV, I know how to do that. So do we have a similar rating system to buy a device? Like say I want to buy a high security device. I want a rating label on it. So this will help inform people what type of decision they make. They want to make buy a CCTV camera or some smart device. A rating can go along with that. So if it is G, maybe I won't go for it because it says it's clearly not secure. Maybe if it says rating A, it's going to be more expensive. So I have to pay a little bit more, but it's going to be more secure. Can also see other type of ratings. So maybe an ISI rating in India. So which talk about like the different devices, what type of features it has, and whether it enables security and so on. So what we are trying to do here is reach to the common people, and they can make informed decision on what type of device they buy. So this morning we heard about IoT in health or health IoT. So let me look at some of the challenges, like as researchers, as faculty members, you want to train your students, you want to look at some problems to look at. So let's go and look at identify some problems and where we can focus on. So I have an elderly father who is 90 years old. So I go talk to my father and say, I want to put a headband, I want to put some camera clips, I want to put a smart watch and so on. And then say, I'm going to monitor you for different data, especially to monitor his health, for example, or how he is going about in his day-to-day activities. We saw the same slide from our earlier speaker, see whether the person is stable, falls down, runs, walks, and so on. So the question now is, the IoT devices that we have, is it ready for a clinical setting? So we looked at several examples. We said, oh, this is fine. But do the doctors agree with what we are talking about here? So if you see on the left row, left column, the doctors say, yes, there are IoT devices that can be used in a clinical setting. Some of them can be used at home, but the doctors are not very happy. They still want us to go to the hospital. They want to do some tests in the clinical setting. So what you see on the right column are things that the IoT devices are not ready yet. So these are challenges that we can look at as researchers. So let's look at some more things that cannot be collected by available IoT devices in a precise manner. Maybe that needs laboratory tests, some imaging technology, and several other technologies that we need to go to the hospital, and only then the doctors are convinced that they are doing the right diagnosis and treatment. So what this particular article by Chun and all, they do is they go through every disease and then try to find out whether the IoT devices are ready for clinical and what are the things that are not available. In this particular table, you can see yes. So these are the type of things that you can use IoT devices readily, and they say no, where we still have to go to the hospital. So the example here is a coronary heart disease, and it talks about screening, diagnosis, monitoring, and then the follow-up. So there is a challenge that we can look at. Anything that says no, there is scope for improvement if it has to be used in a clinical setting. So let me jump to ethics, my last part. The question is, can an IoT system act as caregiver to elderly people? So we want to put some device, an integrated device like a robot, which has camera, which has several other devices fitted onto it. Can it help people at home? Elderly people are likely to have dementia. It affects thinking skills and causes severe memory loss. So essentially, these people are very vulnerable. Okay, so we are doing research with vulnerable people. Is it ethical? Is the technology that we are developing, is it ethical? So this is my day-to-day job. What I do, I look at ethics applications from different researchers, PhD scholars, faculty members. So let me look at the question here. Did you know the cost of caring for elderly people is prohibitively expensive? The most common caregiver for elderly people are family members. The elderly people support other elderly people within the family. And this population is going to grow. So we have in UK and in the Western world, the senior citizens are more than people like people above 60 are more in the population than people less than 15-year-old. So, but it's not all gloomy. If you can see, there's a lot of smile in people's faces. So what if we could replace all the unpaid caregivers with robots? So on the left, we can see people giving care to elderly people. So they can be family members, or they can be employed nurses and other caregivers to support the people. On the right side, you see, we don't need people to give support. We just put machines, IoT devices for elderly care. So will you be happy to do that? So robo have been used, and then that they can serve as a reminder for people to recognize activities, and also to remind to give medication, to take medication. So there are several examples that you can come across in literature. So the robo here acts as a coach, a companion, and it can do several things like suggestions, encouragements, and reminders. This is a summary of things that a robo can do for elderly people. So my question is, will you be happy to bring a social robo with multiple embedded devices and to do research with an elderly person? Will you be happy to do that? If you can type your answer in the chat box, that'll be good.
Yes, we are getting yes answers in the chat box, sir.
And nobody says no and agrees with
No.
me.
Yeah.
So I'm the only person saying no then. So the question is, how will you go about conducting the research? How will you recruit participants for your study? These are very vulnerable participants, vulnerable people. So recruiting people for your research study is going to be very difficult. So for example, if you ask me, I don't give you permission to bring a robot to study my vulnerable mother. So as a researcher, how will you convince me and my elderly mother to bring a robot into our home for your research? The same question is, will you allow a robot to care for your vulnerable father, mother, grandfather, grandmother? Will you do that? So maybe they wake up early in the morning, they are not properly dressed. Maybe they are not in a good shape for the robot to take pictures of them early in the morning. So how will you handle a situation like that? So will you give permission to bring a robot to study an elderly vulnerable people in your house? So
Now
we
the
support,
answer has changed to no.
yeah. So the answer is changing to no. So
Yes.
thank you for joining, supporting me. So there are many things that can go wrong here. We have to be very careful. Has the social technology be proven what we are putting into our home? How long has the technology been used? Since when has this technology been used? How will you gain the trust of elderly people to use the robot? Sometimes they may not be able to make decisions for themselves. So is this research ethical? How will you conduct this research in an ethical manner? These are type of questions that we ask. And the scenario that we are touched here is the technology, the sensor technology, the IoT technology, we want to be more human-centric. It's not just for the humans, we're also looking at it from a people perspective. That has been my emphasis today. So what have you done in my job? So we have addressed the immediate privacy concerns for the privacy of the person and given preliminary approval for this research project to go forward. So we have PhD students working on this project. So we need to be very mindful of the impact for the future. There are going to be positive impact, but every technology has its negative impact, which we need to monitor and mitigate the risks. So to summarize, so we started with different layers. I asked you whether you like sensing layer, network layer, middleware layer, or the application layer. Maybe we should look at one more layer that encompasses the whole thing, which I call here as the human layer in our research. So I think I bring my session to a close. So thank you very much. And there are a few references that I'll be sharing with you. And this is our contact details. Thank you very much. And over to you.
so much, sir. I think who will be the next, sir? Like, is it?
Yeah. Winden will be starting next.
Yeah, sure.
Can everyone hear me?
Yes, sir. You're
Oh,
audible.
excellent. Brilliant. I'll just share my screen now.
Sure.
Brilliant.
Yes, it's visible. You can put it in the read mode.
Excellent.
Yes.
Right. Can everyone see my slides?
Yes, sir.
Excellent.
Yes.
Anyway, then I will start.
Yes,
First
sir,
of all, Vanakkam, Namaste. Good afternoon, everybody. I'm Vinden Wild. I'm a research student at Cardiff Metropolitan University here in the UK, in Wales. And today I will be talking about the Internet of Medical Things, sensor networks, very much in the one moment, please. Yeah, very much in the context of COVID-19. So bear with me. Plus, I'll be talking about more of the social sides to these things, and perhaps a little bit of politics here and there. But I'll try not to get too carried away. Anyway, thank you for having me, and let's begin. So today we'll be looking at, obviously, COVID-19 based, the timeline of COVID-19. So from around about 2019, we'll be looking at the global COVID-19 cases. We'll be looking at full or partial lockdowns from a regional and international kind of point. The economic impact. We'll be looking at any lessons and objectives in moving forward. And of course, when we get to the Internet of Medical Things, we'll be looking at track and trace programs, more specific to the UK. Of course, this presents challenges, as you can imagine, because of all the different boundaries. Internet of Medical Things, obviously, context of COVID, as I said before. And of course, we're looking at artificial intelligence management system. And of course, we're looking at delivery of and the support network through unmanned aerial vehicles, AI, 5G in assisting in disease mitigation. So if we go back to December 2019, the first case, patient 0, it was indicated here in the UK, well, at least in this way. They developed the symptoms of pneumonia and unknown etiology, so we couldn't actually define at this point what the disease was. And of course, we move forward to China, where they alert the World Health Organization that there's several cases of unidentified pneumonia. As you may be aware, there were several stories coming out of the country in regard to doctors and other healthcare professionals raising the alarm. There was a few, it could be said to be controversial at this time. And of course, we move forward into January. And on the 7th, Europe's first case, France announces the first case of COVID-19 in Europe. Of course, we move on to the 11th, first death, China records the first death. And then we get to the 30th, the World Health Organization declare health emergency outbreak. And of course, then we move, I'm gonna have to move this box out of the way for a moment. There we go, that's better. Does everyone can still see? Brilliant.
Yes, yes.
Thank you. And of course, by April in 2020, 1 million cases, global tally confirmed, death toll crossing 50,000. If we move forward to today, just trying to move this out of the way here. Just bear with me one moment. That's much better. And this one here. Is everyone? Yes. Bear with me one moment. Okay. Moving forward to pretty much, April, earlier this year, the global surge of the pandemic. You can see the 7-day moving average of newly confirmed COVID-19 cases worldwide. You can see here a steep climb, indicating kind of a very virulent spread across Europe, the Americas, the Asia Pacific boundaries, Middle East and North Africa, and Africa and other. And that's quite an interesting other. If I move on to the next slide, obviously the source here is from the World Health Organization. So if we look at back in April 2019, this was the initial number of COVID-19 cases by region from the World Health Organization. And if you note here, you will see, I think from my perspective anyway, this highlights the health inequalities across the globe in terms of, I suppose, the health authorities and healthcare providers being able to actually provide any kind of assistance and support to very wealthy countries as opposed to more poorer countries. So if you look at the USA, they're testing 1,003,974. And as we move down across Europe, and obviously into Turkey, to Russia, Iran and China, you can see the cases are dropping there. But of course, a main thing that stands out to me here is obviously the ability and availability of testing. Of course, you could say in the USA, very wealthy country, they would have from the CDC the availability to get resources out to people to do testing. Of course, you move to Spain and Italy and UK, could argue the same kind of thing, more wealthier countries. But as you noticed when I was mentioning in the previous slide, there is quite a big disparity across other parts of the country, other parts of the globe, to include obviously Africa, parts of Asia, down into Papua New Guinea, Malaysia, and those areas there. And of course, this points out again to me health inequalities in distributing healthcare and the provision for healthcare, at least on a global scale. I mean, I was reading this morning, for example, obviously you may all be aware of the Omicron variant. And on the way in this morning, I was listening to the British Radio 4. And they were pointing out about the UN Secretary General, who was talking about how South Africa have been brave in reporting and sharing their science and declaring that they have identified the Omicron variant. However, they are, according to the UN, being punished. They feel that they're being punished in showing this information. However, if you look in CBS News in America, they state that Omicron was in Europe before South Africa. And so you're now getting into, you could say, politics and the distribution of news across the globe. It does raise a few questions. However, with the UN statement, from my point of view, it does highlight and they mentioned a global pandemic treaty, and to help kind of end the cycle of panic and neglect. Because as you can imagine, if we are actually going to, I suppose, even try and tackle the many cases and variants that will be ahead of us. Because if you've noticed, it seems like it's every kind of holiday we get a different variant. So for example, next Easter, it's possible we'll have something else by then. I mean, with the movement of people going across on their holidays, people escaping war-torn countries. There's been high cases and fatalities in regard to a lot of people moving due to climate change, war-torn countries, as I said before. But also, as part of my research, I'm looking at obviously data cleaning challenges. So you can imagine if we're sharing information across borders, the many different types of data and frameworks that are available. If I just move forward here, this is better. So if you look at this slide, you can see there's the national lockdown. Sorry. You can see obviously in red where there's an actual national lockdowns, border, for Canada, Mexico, Australia, South Africa. Obviously, you can see in the UAE. You can also look at somewhere lockdown being eased. Obviously, the USA, Spain, Germany, and so forth. But again, if you look at obviously South America, South Africa, Asia, Mongolia, all it's highlighting the disparities in health and the distribution of vaccines, healthcare. Which I'm going to keep going on and on about through this, I'm afraid. And of course, if I move to the next slide, I'm going to go to the economic impact. Fundamentally, I think, as you may all agree, it could be said that the economy is a significant driver in getting these technological solutions and medicines to the globe. So if you look at the automotive industry, there's a sudden drop in sales. Automobile plants were shut. Sharp drop in stock prices. Of course, as it may be happening again very shortly, high cancellation rates in aviation industry, decreased revenues, and increased debts, obviously, because of the companies that may be forced to go into administration. Obviously, the tourism industry was completely decimated across the globe as a decrease in international travel restrictions, a decrease in consumer confidence, again, high cancellation rates. And of course, a major one here is collapse in oil prices globally, as you can imagine. And of course, especially in the UK here, we're talking about climate change on a large scale. And of course, the collapse in oil prices, you could say, it forces the price of oil to be, I suppose, questionable in regard to climate change. And the World Health Organization and many other organizations in achieving climate change targets. You've got an imbalance in supply and demand with the travel restrictions. Of course, more closer to my home, you've got the government guidelines on the food industry. Instability in food demand and supply. You may have heard recently about the truck driver shortages across Europe and into the UK. Obviously, some would quote Brexit as being a main kind of problem to do with that. However, if that was the case, why is the whole world having this issue? So I would argue against that, obviously. The financial difficulties and potential supply chain disruptions, lack of resources, because of course it impacts the food industry, it's going to impact the healthcare. And of course, if we move to telecommunications industry, I mean, obviously because of people being housebound for significant periods of time, whether they're shielding from a positive COVID test result. Other big companies like Amazon and Netflix, as you can imagine, have profited significantly, no doubt, because many people that at least are able to access these industries. Because don't forget, most of the globe, I'd say but 70 to 80%, won't have access to these kinds of network services and are in extreme poverty in some cases. So if we move to the next. Okay, so we're talking about lessons and objectives. So lessons learned and objectives moving forwards. Of course, from my data cleaning or data privacy, as Professor Edmund mentioned earlier, there's a lack of transparency, so coercion of researchers who recognized COVID-19 soon after it came into existence. I'll refer to my first slide, because obviously, for example, in China, there's a few doctors there that came onto the news network and tried to get news out. However, that was the news was quite small in content. Repercussion was delayed dissemination of knowledge regarding COVID-19 patients. Again, if I refer to my previous slides with the lockdowns and borders and boundaries that you see, this is, obviously will have a global repercussion to this very day. So in us not sharing information is going to be causing problems. So we obviously need to establish stringent guidelines, ensuring the immediate release of information concerning potential health emergencies. Delayed lockdown measures. Obviously, the alleged epicenter of COVID-19 was Wuhan. Established lockdown measures almost a month after the infection's initial identification. A main difficulty in containing the spread of the disease was identified as individuals freely transmit the virus naturally. Isolated high-risk regions immediately after identification of the potential health risk would be a main learning objectives here. Public misinformation and disinformation, because of course the blessing and the curse of the internet in the variety of channels and means to get information that does facilitate some principles like, for example, freedom of choice and freedom of speech. However, if you have a diluted and diversified amount of information, it becomes even more difficult for people to find concrete information to depend upon. This includes government, this includes all, NGOs, healthcare providers, and so on. And of course, you have a rise of xenophobia and frivolous fears surrounding COVID-19, as I may have identified earlier. It could be alleged that South Africa was very brave in reporting. However, there have been European cases and American cases, and you could argue this information was held back, potentially. Who am I to say? So we need to, moving forward to learning objectives, establish rigid policies for monitoring the spread of inaccurate information. And I refer here to the United Nations. They're referring to a global pandemic treaty. I'm a big fan of that, of course. This would be a groundbreaking thing in moving resources equitably across the globe, if we are to even stand a chance of defeating or living with this pandemic or COVID-19 moving forward. Obviously, announcement delay, global public health emergency declared by the World Health Organization almost 1 month after the initial outbreak. And the potential disastrous implications of the outbreak were not really acknowledged. Obviously, many countries were holding back information, or at least performing tests, trying to ascertain and isolate the varying strains, because as you are aware, we have the Delta strain, and now we have the Omicron variant. Obviously, moving forward, proactively monitor the impact of the disease to recognize its threat status promptly. Of course, this depends on, again, I think my theme here is global, getting everybody to share this information, to get it to the right health authorities, to have a good net. And of course, we have our own cognitive biases here and there, all of us, depending on how perceptions on what information we choose to look at and how we interpret this information. So the initial warnings issued by several scientists about COVID-19 were ignored, potentially. Policy measures adopted by various governments met with cynicism. I would agree with that, and I think this is natural, as a lot of people were shocked. Deliberate defiance over government orders leading to further spread of disease. Obviously, there are different governments, different cultures, different ways of being across the globe, all have different ways of varying and dealing with the pandemic. Obviously, moving forward, individuals should make an effort to overcome their cognitive bias and follow government orders. Easier said than done. And of course, the main thing, which I'll be getting more onto, is sufficient stock of personal protective equipment. Obviously, in richer countries, we have a massive, I would argue, surplus of PPE, and our ability in subcontracting again other companies to provide healthcare, we're very, very good at here. However, in sharing with other less wealthier countries, it's from my point of view, it's not been the most equitable of times, let's say, and then we need to do far more in even protecting our species as a whole. Obviously, the repercussions, several healthcare workers exposed to the disease. However, in the UK here, we have, I think it's become mandatory now in the end for all National Health Service workers to undertake the COVID virus vaccination programs, which myself have had the first 2 shots. I'm now awaiting the booster that will be coming. But of course, all of this is all through IoT devices and smartphones. And of course, moving forward, we need a higher degree of pandemic preparedness. So we're into Internet of Medical Things, obviously still in the context of COVID-19. So here in the UK and around the world, we have track and trace programs. And of course, throughout all the regions and boundaries across the globe, many different types of track and trace systems are deployed. Obviously, each country has their own way of doing this, or each region. And of course, you can imagine from a data cleaning perspective, which is what I'm studying at this time, you have massive challenges because of the volume of the data, the veracity. So you have the velocity, variety, and validity, very important parts. So in terms of the veracity and the different types of data and different methods and practices in measuring disease outbreaks, identifying people, recording the information, And of course, identifying the individual and testing capabilities of, like here, for example, be local authorities. And auditing and accountability is a huge problem. And of course, data privacy implications and risks. You imagine all of these different regions and then the kind of the black holes that are left there in the data privacy and data security implications. So obviously, as Professor Edmund mentioned earlier, we have the general data protection regulations that highlight ways and means, definitely the legal way of attaining personal data. We have data privacy mitigation strategies, again, consistency, proportionality, and transparency. In the UK, for example, with vaccine hesitation, we do have bits of that between the United Kingdom, because as you know, this is made up of England, Ireland, Scotland, and Wales. They all have varying views on how to undertake these kind of measures. Of course, this creates a nightmare in terms of consistency. I mean, proportionality is another issue here, of course, because in some places in the UK, it's very difficult to get to people. Say, for example, in the Highlands of Scotland or mountainous areas, just here and there throughout the UK, depending upon the network, because of course, not everywhere here still has the internet. I think it's kind of like a 80 to 90 kind of percent coverage, I think. And of course, this presents an issue in deploying digital solutions. I'm just going to move forward here now. Here we are. So in the Internet of Medical Things, in an effort to mitigate diseases including COVID-19, it's not just COVID-19, there's been many outbreaks, the Spanish flu, there's been foot and mouth here, there's been many kinds of outbreaks, and so we hope that we can use the cloud, cell networks, Internet of Things, Internet of Medical Things to play a key role in wide-ranging tracing and tracking programs. Of course, the test and trace system that was implemented in the UK here, tested in the Isle of Wight, for example, we hadn't really had a test and trace system beforehand, so this is the first time for us here. And as part of these test, track and trace systems, we can deploy artificial intelligence management systems. Some people are very skeptical and very scared of this, which you can obviously understand. This is echoed across the globe in terms of the pandemic in itself and governments withholding information or sharing. So we have disease surveillance. Obviously, this is still very difficult depending on the infrastructure and the country related to its resources, let's say. The risk prediction, I could honestly say I think there are different types of risk matrices that are being used, where obviously if I mention, for example, the Global Pandemic Treaty, I would imagine as part of a risk prediction, a risk assessment would be undertaken to harmonise disease surveillance results. Then that would lead to medical diagnosis and screening, which of course we can use artificial intelligence to carry out experimentation that would normally take us many, many years. This kind of thing would happen in weeks, again with curative research. And of course, if we move to virus modelling and analysis, again, we're using artificial intelligence here to try and at least predict how the particular variants and strains and how their behaviour is predicted. Of course, host identification. This is another thing, of course. For example, the UK Track and Trace programme uses obviously smart devices that communicate within each other. Of course, that will ascertain whether or not you've been in contact with someone else. Some would say this could be a data privacy implications, because obviously the only permissions here are the different applications that have been downloaded. But here, people are pinged when they've been in close proximity without implicit permission, you could argue. And of course, a big one, busting fake news. There is endless busting of fake news. Again, I refer to the blessing and curse of the internet. We have massive dissemination of information, but we also have massive dissemination of very good information. But how do you know? How do you know what is truth and what is fiction? And of course, all of this coming down to enforcing lockdown measures and people's faith and ability in their governments. So we move to IoT telemedicine. Obviously a good thing in identifying individuals, online consultations, as Professor Edmund was mentioning earlier, say elderly care patients, and that's if they can actually use a laptop, because obviously some people may not be as trained as others. Wearable smart devices, medical drones, over-the-phone consultations, and of course we have smart thermometers, we have PCR tests, we have lateral flow testing, mobile applications, and of course if we're moving on into driverless vehicles, you can see there the smart ambulances. I'm not a big fan, but I think at some point in terms of distribution of resources and actually getting people to areas, we will need driverless vehicles, and as pointed here, ambulances. And of course, we go to unmanned aerial vehicles. I think these are going to, well, they do play a key role in disease identification and distribution of resources. We have the multi-purpose drone, which I think I've seen quite a few people using around here. Thermal imaging drones, of course, they can be used in identifying either individuals or groups to tell if there's an elevated temperature of their body, for example, through the infrared spectrum. This can be said to help identify COVID. Announcement drones, of course, as well, to identify to a populace, or at least broadcast to them, to either move around a controlled area, or to even give government updates as to what's going on in health resource distribution. And of course, if you look at the disinfectant drone here, you can see that, obviously in farming, you can use it for pesticides and so on. However, in disease mitigation, you can use different chemicals and use fogging to distribute over large areas. Again, surveillance drones, which we can utilize to obviously monitor all of the above here. And of course, crucially, the medical drone. Obviously, Amazon and other companies will be using similar tunnel technology as well, with certain certain drones and appliances in distributing of medical equipment and supplies, which is key, because I mentioned earlier, some of the regions around the globe are quite isolated. This is a benefit in one way, because you could say like not so much exposure, but at the same time, because of movement of people and because of the distribution of unequal resource distribution, we're going to need vast swathes of medical drones. So I'm just going to move forward. Here we are. So moving on to the summary. I was a bit too quick here, but obviously we looked at COVID-19, timeline of COVID. So you can see, if we're going back to the second slide, massive spike. Lots of different countries across the globe and regions are reporting very similar kind of results. Global COVID-19 cases, partial and full lockdowns, the economical impact, lessons and objectives, of course, in the Internet of Medical Things. We've discussed elements of track and trace, the Internet of Medical Things, again, context of COVID, and artificial intelligence management, just a rough idea of how this works, and unmanned aerial vehicles, AI again, and 5G in terms of the network that they'll communicate through. For example, there's blockchain, there's many other different ways of communicating between a user, a centralized computer system, and drone deployment and resources. Vanakkam, namaste, thank you, and Diolch yn fawr. Thanks for having me.
Thank you, sir.
Thank you so much, Vindu, for your very good knowledge session. And yes, we welcome Mrs. Nisha. Yeah.
Are there any questions? Does anybody want to ask any questions?
Yeah.
No.
Participants have any questions, they can just unmute themselves and they can just.
Am I taking up too much time here?
Yeah, I got a question for you.
Yeah, go ahead.
In decisive applications, storing the data in a cloud can be decisive. Critical applications. In critical applications, as compared to storing in a local server because of its delay in the network and the network issues.
Yes, latency, for example. Yes, but for this specific presentation, I wasn't focusing on the nuanced approach and network and local area networks or anything like that at this time, I'm afraid. We can have
Okay.
another discussion another time for that if you would like. I do
Okay,
apologize.
fine. Yeah, sure. Thank you.
How to estimate the payload for a drone. Wow, we have to look that up, but I would assume there's a fixed specification on doing that. If you look up the specification of a particular drone. Will that be all?
Yeah, there was a question. Hope you have seen it. How to estimate the payload for a drone?
Yeah, I think the only way I could answer that would be
Okay.
specific to the drone. You will find on the inside of the user instructions, you may find that there is a specification that is telling you what the payload of a drone would be. And I think it's different per manufacturer.
Okay. Yeah, I think regarding questions, I think that's it.
Thank you very much.
Yeah, thanks.
Thank
Thanks
you.
for the
Vanakkam.
conversation. Yeah, vanakkam. Namaste.
Yeah, Nikishan, you can invite Mr. Nisha, like, to take over the session.
Yeah. So we have now another resource person, Madam Nishan Ravindran. Madam, are you there? Can you
Yes,
hear me?
I'm here. Would you
Yeah,
like me to
yeah.
share my screen?
Yeah, please.
Okay.
Start. You are already the co-host. Can you just try sharing?
Okay. Can you see my screen?
Yeah, it's
Yes.
Yeah.
Okay, great. Thank you. Would you like me to start?
Yeah, please.
Okay. Thank you very much, Professor Edmund and Vinden, for the previous lectures on sensor data analytics, security and privacy management, especially from the health sector, the IoT sensor networks. My name is Nisha Ravindran, and I'm part of the postgraduate team at the University of Cardiff Metropolitan. Today, I'm going to be discussing with you the security in IoT and network systems. And I'm going to take you through a journey, or more or less my journey, on how the questions have been brought up and how I have tried to answer it. So, anyone remember a typewriter? Okay, it was a long, long time ago. And it seemed a long time ago, somewhere in the 90s, back in Malaysia, where I was from, when using it was a complete new thing, an exciting thing for my own schoolwork. It was only when I got to the UK in 96 that the computer became part and parcel of my life, having now been exposed to electronics and, of course, by the millennium, the mobile technology. Who would have thought that 25 years later, we would be discussing AI, machine learning, smart devices talking back to us? I kind of miss the typewriter sometimes. So what are we going through? You know, the age of digital transformation has been evolving. And this is a snapshot of how the world looks like today. You know, the buzzwords of artificial intelligence, machine learning, Internet of Things, IoT, big data, cloud, 3D printing, drones, virtual reality, augmented reality. Suddenly, we seem to be living in a virtual world rather than the real one. And this has captured the way we live and how we move forward. You know, just like climate change, the sustainability of technology is being questioned and discussed and ever blinded by what will happen next. Before we begin to understand machine learning, we have to start at artificial intelligence. The late Professor Stephen Hawking, one of Britain's preeminent scientists, had said that the efforts in creating thinking machines had posed a threat to our very existence. He told the BBC back in 2015, the development of fully artificial intelligence could spell the end of the human race. Now, that's a strong statement to make. His warning came from a question about a revamp of the technology at the time he used to communicate and facilitate him speaking the mind on the chair that he sat on, which evolved a basic form of AI back then. So, what is artificial intelligence? If you think about it, you can even put it in the chat. What do you find what is artificial intelligence to you? For me, artificial intelligence stemmed from this image. This image right here. And if you're any much of a sci-fi buff like myself, quite aptly, the Terminator movie. This movie was one of the earliest renditions of our images of AI. And if I take your focus to the blurb, it mentions in the film, year 2029 being the year AI ruled the world. Now that's just in under 8 years' time. Imagine Arnold Schwarzenegger's Terminators walking around telling us what to do. So artificial intelligence means different things to different people, according to Wang 94. And the primary goal is to build an intelligent machine. The second goal is to find out about the nature of this intelligence. So unlike natural intelligence that is displayed by humans and animals, which involves consciousness and emotionality, although saying that shoots of AI are beginning to understand and grow in this model. So machine learning, what is machine learning? Machine learning is a branch of artificial intelligence from AI focused on building applications that learn from data and improve the accuracy. So it's constantly learning, and it's being programmed in a training data set to say, right, this is what I need to do next, and then learn like how humans learn in developing new skills and new tools. So for example, you take an ordinary system, you introduce AI in the form of Arnold Schwarzenegger as T-800 Cyberdyne, give him a mission which was to be sent back to kill Sarah Connor, and off he went. In later films, he was given, at that time, he was given limited information and only using the phone book, remember the phone book at the time, to get her location. In later films, machine learning, mathematical algorithms and decision-making methods were added so that the machines could learn, predict, improve their learning state, producing machines of the future. Once machine learning was introduced, the original T-800 was sent back then to protect Sarah Connor. Classic tale of good versus evil through machine learning. So let's apply this to real life and where 2021 really is in regards to machine learning. So in my own postgraduate journey, I've been trying to answer some questions. So question one was an experiment that was conducted using 3 devices, and this has become a paper that has been published. The paper was an experiment conducted using 3 devices, Snort, pfSense, and Cisco. So this is from a technology point of view. These are packet sniffers to monitor the network of oncoming and outgoing traffic. A live environment was set up and cyber threats were observed. The experiment required engineering knowledge and awareness to set up these devices to use machine learning, features such as signature and anomaly-based rules. This was allowed to run for a period of 1 week, and the aims were to identify and detect and protect any intrusions coming into the network. I echo my colleagues, it was also colleagues' previous slides about General Data Protection Act, which is actively set in place in the UK. And this was to protect the data with the use of an understanding of GDPR. So the comparisons using these open source codes such as Snort and pfSense and commercial network intrusion devices such as Cisco and their impacts on threats and how they attack. The methodology that was used here in this observation, evaluation, and experimentation method, which was applied, which identified variables that occur and whether this occurrence is in relation and associated to external variables as using various AI and machine learning algorithms, such as signature and anomaly-based models to detect these unknown attacks. What were the findings? So there were 3 sections to the finding: the cost, the rules, and of course the intrusion detection system device itself. So the conclusion was, while Snort and pfSense were very cheap to maintain and free to download on open source, they both required knowledge and community intervention to change and implement these rules to detect zero-day attacks. They both required big computing power and knowledge of these devices. I think a colleague in a previous lecture asked, what is the computing power? One of the questions raised it. Computing power and latency was known as well within this experiment in terms of various devices being used and the capacity in which it was being used for trying to detect these anomalies through the system. Cisco, on the other hand, was very expensive. It's a cost. You buy the name. The cost includes rules linked to the mainframe of Cisco headquarters to detect these zero-day attacks. So any rule changes were done that are done by Cisco themselves, and it's a paid-for service if you want to use the machine learning subset to increase your protection. So you're buying into the bells and whistles, a subscription license model. So you need to find the balance between the two. Then I realized, as much as question 1 was leading the technology, the general public and organization around this evolution of technology were none the wiser of what was happening. So technology was advancing quickly at a rate that people did not understand what was happening. So the AI and ML lingo was advancing, and regular people could not keep up unless they were at the top of the technology chain, or an academic, or an organization that specializes in IT and security. My little drawing of my software is safe. What is machine learning? Tell me. Hence, the second paper that was published was looking at the awareness of the humans, of us, of people, of the environment, of using these end devices to run their business for education and to obtain the knowledge, i.e. phones, iPads, computers. It was easier for them to back away and not take an interest because they needed to run their business and they needed to use all these devices to do so. There was no reason to take an interest in technology due to them not having time or the belief that it will not impact them. So the second question was to bring to the surface the awareness people had towards machine learning to combat cyber threats through cybersecurity software packages. So what did we find? So it was very interesting. The methodology was a structured survey question on a selected small number sample. This was a pilot study run, and since then we've actually expanded on this pilot study to go across 120 samples, which hopefully, fingers crossed, will be the next paper. But this one was a pilot study just to intervene to see the snapshot of where people were in terms of the awareness. So the organizations were asked if they had cybersecurity software packages in place and if they knew what they had paid for. Questions of ML were asked, and they knew it was being used as part of their protection to help increase their detection of the ever-increasing zero-day attacks. If you can see the pie chart, it shows that awareness of ML within these organizations were very poor. And it was shocking to see that only 30% of the organizations were aware that machine learning was even part of their software packages. And of those 30%, the people that knew, neural networks, Bayesian, support vector, was there in their sorts. And there were quite a large number of people who thought it was not applicable. They knew machine learning was there, but they thought it was not applicable, or they didn't know. So both papers, question 1 and question 2, showed a gap of machine learning device knowledge. It showed weakness in our perception and awareness of machine learning in this particular case, the UK business mind. It highlighted also funding gaps that could be fulfilled by government to support organizations understand and implement machine learning to protect their data, because eventually that's the biggest commodity that they have. Obviously, they don't understand that concept. And of course, to recognize the importance from the management level and staff to be aware and undergo training to better understand the benefits of machine learning in cybersecurity from an intrusion detection and prevention of cyber threats. So just going into the academic side of things for a minute, cybersecurity refers to the measure of protecting computer systems, networks, and information from any disruption or unauthorized access, use, disclosed modification, and destruction. So that's cybersecurity. And then lies the next section, which I'm going to bring you to or open the doors to, is Internet of Things, which refers to the network devices that interact with the physical surroundings and communicate over wireless networks in social context to offer a human-centric application value. Okay, so it's trying to understand one solution to marrying all the terminologies here, bringing together the importance of understanding where intrusion comes from, how it is detected, how the prevention of cyber threat occurs, not only in a networked system that we understand and we're used to, but looking at how AI and ML can help in all the devices that are now entering our platform or entering our cyberspace, i.e. The iPads, the phones, my smartwatch here, the fridge and so on, which aptly brings me to the next slide, which is, Internet of Things, connecting the world. So how do we tie all the IoTs coming together? Fundamentally, there's a positive here because you're connecting people and you're connecting people to the world. And how important was it during our COVID times when we were all locked down and the only thing that held us all together in terms of communicating and finding information throughout the pandemic was through the internet. So everything we touch now and own is going to get smart or is already smart. IoT applications fall into various different categories. They are, of course, to enhance our space in which we live in, so the homes, the offices. It also is to empower the device we use, such as appliances and vehicles. Vehicles having to, if you look at the picture here, there's, you're looking at vehicles, you're looking at homes, you're looking at animals, you're looking at emergency, the health system, as my esteemed colleagues explained earlier, working from home, homeschooling, social media, factories, automating, improving the efficiency of production and delivery system, i.e. Amazon. The amount of Amazon boxes that came through the door during this time was quite powerful. Okay, that's great. I'm just checking. That's fine. Yes. Absolutely. I think there was one, AI is which we imagine that is already discovered by science and cosmos. Thanks, Kavita. Yeah, that's a really good statement to make. Absolutely. So taking a look at the slide, I just want to reach out that, these are all the various devices that are currently being used in our environment, but there's a lot to think about. There's absolutely a lot to think about, what are the accuracies of these devices? What are the censoring ability of these devices? How are you going to link your iPad, phones, domain portals, login pages, social media, Facebook, Twitter, Word documents, even Word documents are becoming predictive text, which is more accurate because it's learning. Machine learning is becoming the hub of how we utilize these devices in connecting to the world. But there's one problem in this picture. There's absolutely one problem in this picture. Can anyone highlight what's wrong with this picture or something that's disturbing in this picture? Can anyone identify it? I'm reaching out to, that's all right. Can anyone see in this picture, in this web of Internet of Things? Yes, thanks, Professor Edmund. The hacker, can you see this man with the blue shades? They say never trust people with shades. Absolutely. So yes, so indeed. So where there's smartphones, fridges, washing machine, heating, it's all here today. There are malicious activities out there that want to penetrate and obtain information. But what are all these Internet of Things collecting? Okay, what are they collecting? Anyone? What sort of things are they collecting? Okay, so what does IoT ultimately give? Yes, bank account numbers, credentials, yes. So they're all data, okay? They're all data. So if I go on to the next slide. So data collection is a huge thing where you have data, okay? So there's billions and billions of data coming through your phone number, your credentials, you know, how much food you have in your fridge, whether your vehicle is able to go how many thousand miles. So where there is data collection, where there's data collection, there is obviously the ultimate power to use this data. And power, if used in the wrong hands, leads to the ultimate control. Okay, and who wants the ultimate control? Malicious organizations to take over the world. Very interesting point here in terms of data and how machine learning falls into the category of network intrusion, helping in network intrusion detection. There was a paper by Q, Dong, and Zhang et al. On the adversarial attacks against network. And this was really interesting when I read it. So it was deep learning that obviously has gained a lot of interest within the network intrusion detection due to the strong capability of recognizing subtle differences between normal and malicious network activities. So although a variety of methods were designed in this particular research, the deep learning models for security protection were looking at the system's vulnerability to adversarial examples. So a slight shift in changes within the network traffic. So what methodology did they use here? They designed a novel adversarial attack against DL-based network intrusion detection systems, NIDS, for the Internet of Things. And they saw how the Internet of Things coped and corresponded with this methodology setup with only one black box access to the deep learning model. Then they introduced two techniques. They introduced a model extraction in adoption to replicating what was in the black box with a small amount of training data. And also they had a little map that was used to disclose any impact of every packet that was coming in into these IoTs to detect any results and critical features that were being attacked. What was the outcome? Efficiently generated adversarial examples were using conventional methods to come in. With these techniques, they successfully compromised the state-of-the-art network intrusion detection systems. The adversary only needed to modify less than 0.005% of the byte in the malicious packets to achieve an average of 94.31 attack success rate. So this was quite interesting because it showed the vulnerability of our IoTs. So why are our IoTs vulnerable? I think my colleague explained earlier, you know, just one item, one Fitbit, you know, it has its own life, has own manufacturing, has its own, you know, guide, setup instructions, software update. If I, as a user, do not keep up with my Fitbit, it could be a potential threat in hackers trying to hack my personal data. So this Fitbit contains my health statistics. It tells me what I'm doing in my daily life. It tells me when I go for an exercise, when I cycle, when I'm at rest. So there's a lot of personal information. And of course, in the guidelines of GDPR, that is my information. It's my consensual agreement to share this information with other people. Of course, we have the hackers with the blue shades that are just, you know, surfing the internet, unable to be identified, and we're hoping that you know, these IoTs will have a proper tracking system or mechanism to be able to avoid that. So you can see here, you know, hardware within the house. You've got your CCTV camera, as I mentioned, the IoT devices. You've got things with RFID chips in them. You know, they're talking to the network. They're constantly talking to the network wireless, whether it's networked, wireless, or wired, and that goes on to your home router. and it goes into the gateway, and it goes into some sort of cloud data service, and then it hits your IoTs, your phones, in which you're constantly, your phone becomes your central location. If you don't update your phone, if you don't look at authentication, mobile insecurity, looking at your network services, or even lack of security configuration, it becomes a privacy concern. It becomes a physical insecurity, and it becomes a target for malicious software. So as people, as end users, we need to be aware, we need to understand that all these inadequacies in our IoT and the challenges need to be looked at, need to be aware. So what are the challenges? What are the basic things that we need to do? What are the high level protection that can be shared? So I'm coming to the end of the lecture here. We're looking at, how more questions need to be answered, okay? We need to look at access control of our IoT devices, our fridges, our washing machine, our cars, our Fitbits, our phones. We need to look at the privacy behind it. Who's enforcing these policies? Who are the people that we can trust? Can we trust this device? Can we trust the manufacturers? Mobile security, doing updates. Is it something that we need to do? Are the critical updates any good? How can we cope with securing the middleware? How can we cope with the confidentiality, authentication? And suddenly the mind is just blown away of how we can cope by knowing how can we cope in knowing that every single device out there is secure and is protected. So AI and machine learning suddenly through IoT has a collection of this data that showcases a person's living habits and patterns. And we're hoping that the machine learning capabilities of each of these individual IoTs, coupled with the machine learning overview from a network intrusion detection system and how that interaction happens, might work in the future. So it's identifying good or bad machine learning capabilities and how that marries together. So I'm going to end the presentation today with this little cartoon, which was quite apt. Here just to complete the presentation, it's a food for thought. Imagine if this happened. The wife and two children. Apparently, our smart house decided it did not need us anymore. And then the husband's going, let us in, let us in. So imagine if this was the world we lived in. Thank you for listening. And these are our contact details as well. Any questions out there?
Yeah, thank you, Nisha madam. So participants, if you have any questions, please put it in the chat box as usual we do, or we can just speak and muting yourselves. Anyone?
Which are the current algorithms that's being used in security of IoMT?
Hi, Dr. Sankar. Yes, I think with IoMT, I might need to pass it over to Vindan, but certainly, as I mentioned earlier, the IoT security, it depends on, it covers a range from a network intrusion detection system. Obviously, as I mentioned in the presentation slide, deep learning is one of them. Obviously, you've got Bayesian support vector network. So it all depends on the situational circumstances and scenarios of the IoT. Vindan, would you like to expand on IoMT, please?
I can do that. Let's see. Right. In terms of Internet of Medical Things, I think we were looking, I think both of us were looking at a blockchain network. And of course, in the blockchain network, we use encryption algorithms with different public and private keys. So I'd say first it would be the encryption algorithm. And of course, there are also different types of algorithms like homomorphism, which can blend and standardize different amounts of data. But I think I'm going to focus primarily on the blockchain algorithm here, which obviously you get the information and it will encrypt it, store it in a block. We have a consensus algorithm that is with all of the participants in the blockchain itself would give consensus then. I think that would be a main one. Does that answer your question?
Yep. Thank you.
Thank you.
So just to, I think there's a question here. I think there was a question here as well. In IoT, do we need lightweight algorithms? How do deep learning fit into it? So the deep learning and complexity of machine learning that I spoke about was at a networking level. So you're talking about the network intrusion devices, the almost overarching security within organizations or within larger devices that are monitoring incoming and outgoing traffic. As a person going into an office building, I might bring my iPad, I might bring my phone, my Fitbit. So all these are connected to the Wi-Fi, for example. So the constant machine learning that's happening at the network intrusion detection level will just oversee and uses a much more capacity driven machine learning. For the lighter, as Vindan just explained, encryption keys, public, private keys, they are good. But certainly IoTs, smart web, things to predict the weather, for example, may use support vector regression, economic market analysis, energy uses, you might use linear regression and so on. So there's a vast variety of machine learning algorithms, being light or heavy, that can be used. I hope that answers that question.
Yeah,
Vindan, I think there's a question for you as well. Vindan, could I bring you back there? In context to blockchain as a security solution, which consensus algorithm is best suited for IoT systems?
तुमच्यापैकी किती लोकांनी बायोडेटा फॉरवर्ड केला होता मला सांगा.
Short answer, I couldn't tell you at this moment. I'll have to get back to you on that because there's so many.
I think the general consensus here is there's a wide variety that can be used depending, which is the challenge, Vindan, isn't it? It is the challenge. The uniformity of bringing one standard is not going to be the case. Yeah, scalability and energy efficiency. Yeah, absolutely. Is there any more questions? If not, I'll hand it over back to the chair. No problem. Thank you.
Yeah.
Thanks for having me.
Yeah. I think. Dr. Victor Paul. Yeah.
So that was a very great session, I should say. Like within a short span of time, 3 different resource persons, 3 different perspectives, and all our research evidence discussions. That was very great to have. And we thank Professor Edmund and Mr. Vindan and Mrs. Nisha for a great session. And we hope like audience might have got a very fruitful knowledge from this particular session, especially with respect to security part. And yeah, we thank you all for this particular session. And we hope we can collaborate and you will get a lot of queries from the participants as well. I hope so.
So thank you very much, and we'll continue to collaborate.
Sure.
And please feel free to write to us. And thank you and bye.
Yeah, Unikrishnan, yes. Yeah, thank you.
As Dr. Victor Paul
one second. I just want to say thanks to Vindan, especially for that Vanakkam and Namaste. And it will stand there. Yeah, thank you.
Yeah, that was so nice of Vindan. So yeah, so it was slightly pointed out by Dr. Vitipol. It was a great session. It was the whole team was giving lots of content basically. As rightly pointed out, 3 perspectives: IOMT and all that stuff. So it was definitely helpful for our participants, and thanks for this session. Yeah. So for participants, the attendance link, it is posted already. Session 10, I have just reposted it. If at all anybody have missed it, and session 11 also I have posted it right now. So if you want, I can just post it once again for session 11 link. Yeah. So please fill it up. Let us meet back at 2:30 for the next session. Okay.